Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about dental bonus structures. So what are the different types of bonuses that a dental associate can receive, and then maybe some red flag areas that you want to make certain you're taking care of in your contract before you sign the agreement. So there are many different ways of structuring compensation for a dental associate. Obviously, the easiest would just be a straight base salary, where you just come in, do your work, get your your normal base, and that's it. That's probably uncommon in the dental industry. A daily rate would be more common. So you could have a position where you just come in, and then for every 8-hour shift or whatever it is, you get paid a set amount, usually somewhere between, I don't know, $700 all the way up to $1,250, depending upon specialty. So that's an easy way of doing it. I'd say the most common method would be some kind of percentage of collections. And so that's, I guess, what we're going to talk about in regard to bonusing. So a normal way of doing it for dental associate is you would come in and then you would have a minimum guarantee for a period of time, maybe somewhere between 6 months to a year, where they would say, at a minimum, you're going to get a daily rate of X amount of dollars, or you will be on a base salary with X amount of dollars for the first 6 months, and then it would transition into a collections-based agreement. And in a scenario like that, you would transition, and usually for most dental associates, it's somewhere between, if you're doing like general practice, 30 to 35%. Now, normally most practices will also take out lab fees as well. So if you're in a specialty, that's lab fee heavy, that's one thing to think about. And most of the time they'll tie the percentage of your lab fees to whatever your percentage of collections is. So if you have 30% collections, then normally they would make you pay for 30% of the lab fees. Now, this does vary pretty widely between places. Some places will make you pay 100%, others zero. There's not a lot of rhyme or reason to it beyond just what the practice wants to do. But the most common way of doing it is just whatever your percentage of collections are, that's what your lab fees would be. Now, there are hybrid models as well. And so how those would work is most of the time you'd either have a straight base salary or a daily rate, and then they would do some kind of reconciliation either at the end of the month, end of the quarter, sometimes at the end of the year. Obviously, a shorter interval would be better, meaning getting it monthly or quarterly versus a year, and I'll explain why in a second. And then they would say there's some kind of threshold. So if your collections exceed whatever they paid out to you during that period, you would then get X percentage of anything above that. So that's normally not going to be as high. So you wouldn't get 30 or 35% if you're on a guaranteed base or daily rate. It'd be lower than that, usually somewhere between 15 to 25%. And then they would do the reconciliation, and if it was higher, then they would pay it out, normally within 30 days of whatever the reconciliation period is. One thing, or I guess a few things to think about. One, you want to have that language in the contract that says they will pay it out within X amount. Many times they'll be very kind of vague about when it's paid out. And if you get in a scenario where you've given notice that you want to terminate the contract to the employer, and there's no kind of set date when they pay out a bonus, I've seen plenty of times where the owner will just drag their feet on paying the bonus until the contract is terminated. Most contracts have some kind of notice period, usually between 60 to 90 days. And so the owner, and there'll also be language that says you can't receive any bonus if you're not employed at the time it's paid out. And so they'll just drag their feet on paying it out. The contract terminates, and then you're out of your bonus. So that's pretty frustrating for some dentists. And that's why you want to make certain that there's strong language that says it will be paid out, or if you have earned a bonus, it will be paid out regardless of whether you're employed at the time it is paid out. And then last, you should have something in the contract, especially if your comp is based on collections, that says you will receive any kind of, whatever percentage you're on for 90 days after the contract terminates. It can be pretty frustrating when, let's say the last month that you're working there, you see all these patients, and maybe you're in a insurance heavy practice, and although it does vary, an average accounts receivable cycle could be 30 days for some practices. And so the entire month that you worked, none of that money is going to come in until after your contract is terminated and you've left the employer, and now you're stuck because you can't get that money or you don't get credit for it. So that's another thing to make certain is in your contract, that if you have earned a bonus, or you will get credit for any of the collections received up to 90 days, 6 months, whatever you want to be, or put in there. And that way you're not leaving money on the table, because these are all things these are encounters that you've had, services that you provided, so you should be getting credit for them. So that's a little bit about dental bonus structures. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Bye.